My name is Gary Gesselter. I'm a surgeon on Long Island, about 15 miles from the US epicenter of the COVID-19 pandemic. I am in the basement of my house trying to keep as far away from my 94-year-old mother-in-law. The issue is that as a healthcare worker, obviously I'm at greater risk of exposure and therefore could become an asymptomatic carrier inadvertently contaminating my elderly mother-in-law as well as potentially infecting my entire family. When we look at the Wuhan experience, anybody who was sick or COVID positive was immediately cohorted in a camp where they received shelter and food and group exercise classes. When I look at the situation here, we have patients who are turned away from the emergency room because they're not sick enough to be admitted. Thankfully, they are the majority, but they have to go back to their families. There is an obvious and financially sound solution. There are hundreds of thousands of hotel rooms in Manhattan. We have thousands of hotel rooms on Long Island, and they are absolutely empty because of our obvious travel crisis. This could easily be mitigated by immediately releasing funds from this recovery plan to the hotel industry to allow them to cohort these positive COVID patients and symptomatic patients in hotel rooms where they will receive good food, shelter, and social activities. The key to this plan is for the people who are found to be COVID positive or symptomatic get sent at no charge to a hotel, and the tab gets picked up by the government. For this to become immediately effective and obviously to facilitate flattening the curve of global infection, this requires the legislature to release funds, to meet with the hotel industry, and the easy part, I think, will be by providing healthcare workers who do not have to be overly skilled to take temperatures, monitor patients, and assist in quarantining methods so that the workers do not come in contact with the patients. I appeal to those who can make this happen to get underway as soon as possible. Thank you.